What are the key symptoms for various forms of anemia? Imagine feeling tired all the time, even after a good night's sleep. That's often one of the first signs of anemia, a condition where your blood doesn't carry enough oxygen. But not all anemia types show the same signs. Let's explore the key symptoms for different kinds of anemia, including sickle cell disease and others. Starting with sickle cell anemia, which is inherited and caused by abnormal hemoglobin. The red blood cells become shaped like sickles or crescent moons, making them less flexible and more likely to break down. People with sickle cell often experience chronic fatigue and pallor because their red blood cells aren't carrying enough oxygen. They may also have episodes of severe pain called sickle cell crises, which happen when sickled cells block blood flow. Swelling in the hands and feet, frequent infections, delayed growth in children, and vision problems are also common. Because the cells break down quickly, jaundice or yellowing of the skin and eyes can occur. There's also an increased risk of stroke and organ damage due to blocked blood flow. Iron-deficiency anemia is another common type, caused by not having enough iron to produce healthy hemoglobin. Its symptoms include feeling very tired and weak, pale skin, and cold hands and feet. People might notice brittle nails, headaches, dizziness, and sometimes unusual cravings for things like ice or dirt, which is called pica. This form of anemia often results from blood loss, poor diet, or problems absorbing iron from food. Vitamin B12 deficiency and folate deficiency anemia are known as macrocytic anemias because they cause larger than normal red blood cells. Symptoms include fatigue, weakness, pale skin, and shortness of breath. Because vitamin B12 is essential for nerve health, deficiency can lead to neurological symptoms like numbness or tingling in the hands and feet, difficulty walking, memory issues, and mood changes. Pernicious anemia is a specific type where the body cannot absorb vitamin B12 properly. Thalassemia is an inherited condition where the body makes abnormal hemoglobin. Symptoms can range from mild to severe and include fatigue, weakness, and pallor. Some people develop yellowish skin, bone deformities especially in the face, and slow growth. Enlarged spleen or liver may cause abdominal swelling. Hemolytic anemia involves the premature destruction of red blood cells. Besides fatigue and pallor, symptoms include jaundice, dark-colored urine, rapid heartbeat, and an enlarged spleen. It can be inherited, like in sickle cell disease or G6P deficiency, or acquired through autoimmune diseases or infections. Normocytic anemia features red blood cells that are normal in size but fewer in number. Causes include sudden blood loss, chronic illnesses, kidney disease, or bone marrow problems. Symptoms are similar to other anemias: fatigue, pallor, shortness of breath, and weakness. In sickle cell disease, the hallmark symptoms are related to both the anemia and the blockages caused by sickled cells. These episodes of pain and the rapid breakdown of cells set it apart from other types, which mainly cause symptoms related to reduced oxygen delivery without the painful crises. Remember, all these symptoms reflected the body's struggle to get enough oxygen to tissues. If you notice signs like persistent fatigue, pallor, or shortness of breath, it's important to see a healthcare professional. They can perform tests to determine the type of anemia and recommend the best treatment. Always seek personalized medical advice, as each person's experience can be different.